So we're all done now with your procedure. I'm just going to give you a couple of instructions. So you'll be numb for the next 4 to 6 hours. So I would just refrain from chewing on that side. We don't want you to bite your cheeks, your lips, or your tongue. Bleeding is completely normal. The only thing we do look out for is your gauze being completely soaked in blood. If that seems to happen, you can go ahead and give our office a call and we can get you in and figure something out for you. Sutures are placed. Those will dissolve within the next 5 to 7 days, so it's not something that you have to worry about at all. For activities, I would go ahead and just lay low and relax for definitely for today and maybe like the next couple of days. Just don't do anything heavy because we don't want to form any blood clots that could be bad. We don't want you to get a dry socket, so it is normal to get a blood clot on the back of that tooth. That is completely normal. Do not try to pick that out, which and if you do, it could cause that dry socket. It could be very, very painful, and we don't want to see you back for that. For diet, I would go ahead and eat as tolerated, but I would recommend for you to do really soft foods for the first 24 hours, like ice cream, jello, and drinks. You do not want to drink out of a straw at all, just for the next week or so, just to make sure we don't want to take that socket out or anything like that. A fever is normal for the first 24 hours. If it lasts longer than 2 days, I would go ahead and consult your doctor and get a doctor's appointment to go in there, just in case of any infection that could happen. You can go ahead and brush your teeth as normal. When it gets to that site, I would just be really careful when you brush on that site because you don't want to hurt it, you don't want to pull out that blood clot or anything like that, but you're good to go as normal. I would do a cold pack and a hot pack. So for the first 24 hours, go ahead and do a cold pack, do 20 minutes on, 20 minutes off, and then after that you can go ahead and do a hot pack, which would be also 20 minutes on, 20 minutes off. If you have pain, I would go ahead and alternate between ibuprofen and Advil, and if the doctor prescribes you a medication, just take that medication that's prescribed, take it as long as it says, and even if you feel like you're feeling better and you don't need it, go ahead and finish it off because we don't want any infection to occur after that. And do you happen to have any questions for me?
No.
Okay, awesome. Thank you.
Your birthday.